Hi, I'm Dr. Andrew Dixon from Radiopaedia.org, and in this video tutorial, which is a pre-course video for our Medical Imaging Anatomy course, I'm going to be talking to you about types of joints. The anatomy course is coming up in Melbourne on April 9, and it's going to be live recorded and released on video on demand on the 1st of May. If you haven't registered for the full 6-hour course, then visit radiopaedia.org/courses. Joints are defined as sites of close physical connection between bones. Some joints are temporary, found only in the developing skeleton, whilst many, such as these three examples, are found in the mature skeleton. In this tutorial, we're going to concentrate on learning the three structural types of joints: the fibrous joints, such as the skull sutures, the cartilaginous joints, such as the pubic symphysis, and the synovial joints, such as the hip joint. And these three structural types of joint are defined by the tissue that binds the bones together. And we're going to look at each of these in turn, beginning with the fibrous joints. A fibrous joint is joined by strong fibrous tissue rich in collagen. These joints are defined functionally as being synarthroses, in that they allow very little movement, if any. Examples of fibrous joints include the skull sutures and the sutures between the facial bones. Here we have the zygoma having a suture with the frontal bone, the temporal bone, and the maxilla. The syndesmosis is another example of a fibrous joint. Syndesmosis exists between the radius and the ulna in the forearm, and while it binds the radius and the ulna together strongly, it does allow the radius to rotate around the ulna to perform supination and pronation. A syndesmosis is also present between the tibia and fibula within the leg, and it's particularly strong distally at the distal tibiofibular joint. If this syndesmosis is disrupted, such as in this case where there is a Weber C fracture with widening of the syndesmosis and the medial ankle clear space, then this creates a very unstable ankle joint and requires surgical fixation. The gomphosis, one of my favourite joints, is another example of a fibrous joint. This is where the tooth is held tightly to the alveolar bone of the maxilla or the mandible. The next type of joint is the cartilaginous joint, and these joints are joined entirely by cartilage. The word entirely is important here because, as we'll see, synovial joints do contain some cartilage. Cartilaginous joints can be divided into primary and secondary. The primary cartilaginous joints are fused by hyaline cartilage and are termed synchondroses. Synchondroses are almost always found in the developing or immature skeleton and exist between separate centers of ossification, often within the same bone. For example, the epiphyseal plate or growth plate is a primary cartilaginous joint between the ossification center here and the primary bone. Similarly, at apophyses, which are secondary centers of ossification often associated with tendon insertions, the same kind of thing happens. So if we look at this child's pelvis, you can see here a synchondrosis, where bone is ossifying within the iliac crest, synchondrosis joining it to the remainder of the iliac wing. Same thing down here at the greater trochanter ossification center, with a synchondrosis joining that ossification center to the remainder of the femur. Apophysis for the ischium here, attaching via a synchondrosis to the remainder of the ischium. And in the even less mature pelvis, the bones of the pelvis itself, the pubic bone, the ischium, and the ilium come together at the triradiate cartilage, another example of a synchondrosis in the immature skeleton, a primary cartilaginous joint composed of hyaline cartilage. Only a few primary cartilaginous joints persist in the adult. The most important one is the petrooccipital synchondrosis between the clivus of the occipital bone and the apex of the petrous temporal bone. And this is important radiologically because it's a site where chondrosarcomas can occur. The first sternocostal joint is another example of a primary cartilaginous joint composed of hyaline cartilage that persists in the mature skeleton. Primary cartilaginous joints can also be present as abnormalities. For example, here is a synchondrosis between the calcaneum and the navicular, a calcaneo-navicular coalition. So we've dealt with the primary cartilaginous joints. Now let's look at the secondary cartilaginous joints. And these ones are composed entirely of fibrocartilage and are termed symphyses. Now these joints, functionally speaking, are amphiarthroses in that they allow a very small amount of movement, but definitely do allow movement. All the symphyses are found in the midline of the skeleton, and the stereotypical example would be the pubic symphysis between the two pubic bones in the midline and the intervertebral discs which exist between the vertebral bodies in the vertebral column. The manubriosternal joint is another example of a secondary cartilaginous joint, a symphysis between the manubrium and the sternal body. This patient also has a fracture of their sternum. So that's cartilaginous joints. Now let's move on to the final form of structural joint, the synovial joint. Synovial joints are joined by an articular capsule which is lined by a synovial membrane which secretes fluid into the joint cavity. Synovial joints, functionally speaking, are considered diarthroses in that they are freely mobile. Here's the typical example of a synovial joint. We have the articular capsule joining the two bones at the margins. You have a synovial membrane at the inner aspect of that articular capsule attaching to the margins of the articular cartilage. Hyaline articular cartilage covers the surface of the two articulating bones, and synovial fluid sits within the joint cavity. I just want to emphasize the importance of understanding that synovial joints still contain cartilage. They're not cartilaginous joints. By definition, they are synovial joints, but they do contain cartilage. Not only do they contain the hyaline cartilage on their articular surface, here on the femoral condyle and the tibial plateau, but also fibrocartilage, often in the form of a cartilaginous disc here in the knee, the menisci. Also over here in the shoulder, you can see hyaline cartilage on the glenoid here and on the humeral head, and fibrocartilaginous labrum helping to deepen the socket of the glenoid. So just worth remembering that cartilaginous joints and synovial joints are different. Even though synovial joints contain cartilage, they are not examples of cartilaginous joints. Synovial joints can be further classified based on their form and the movements that they allow. The number of movements that a joint allows is often referred to as degrees of freedom. And here are 6 different types that we're going to run through. The first is the ball and socket joint, and this is where a spheroid articular surface articulates with a cup-like depression within another bone. This joint allows 3 degrees of freedom, flexion and extension, abduction and adduction, which together result in circumduction, and importantly, they allow axial rotation. The hip and the shoulder are typical examples of ball and socket joints, and here we have the hip on MRI, a nice ball-shaped femoral head sitting within the cup-like depression of the acetabulum. The next type of joint is the condyloid joint, which is very similar to the ball and socket joint. However, instead of having a perfect spheroid articular surface, this has an ovoid convexity which articulates with an ellipsoidal cavity. And so this still allows flexion and extension, abduction and adduction, and therefore circumduction, but it doesn't allow axial rotation. The radiocarpal joint is a good example of a condyloid joint with the ellipsoidal cavity of the distal radius articulating with the ovoid convexity of the scaphoid and the lunate. The metacarpophalangeal joints are also examples of condyloid joints with the ovoid convexity of the metacarpal head articulating with the ellipsoidal cavity of the proximal phalanx base. The saddle joint allows exactly the same types of movements as a condyloid joint, but does it by having interlocking saddles articulating by reciprocal reception. Saddle joints allow flexion and extension, abduction and adduction, and therefore circumduction, but again, they do not allow axial rotation. The first carpometacarpal joint of the thumb is the best example of a saddle joint in the human body. If we have a look at this X-ray, we can see here that the base of the first metacarpal has a saddle-like depression in it for articulating with the trapezium. If we have a look on MRI, you'll notice that this joint contains a fair bit of fluid and has a very thick capsule consistent with this joint being very mobile. And if you're a person who likes to twiddle your thumbs, then this is the joint that allows you to do that. A hinge joint is where a convex surface articulates directly with a perfectly corresponding concave surface, and this will allow only 1 degree of freedom, and in the human body that is generally flexion extension. The elbow and the interphalangeal joints of the hand and feet are classic examples of hinge joints. You can see here the distal humerus coming down and forming the trochlea, sitting within the trochlear notch of the ulna. The convexity of the condyle perfectly fits into the concavity of the notch, allowing for only hinge-type flexion-extension movement. The interphalangeal joints of the hand, again, perfectly shaped convexity, sitting within the concavity of the middle phalanx. The ankle joint and the knee joint are primarily hinge-type joints. However, the ankle joint does allow some eversion and inversion, and the knee joint allows a little bit of rotation, and therefore they are considered modified hinge joints. The next type of joint is the pivot joint, and this is where a bone axially rotates within a ring. Now in this picture it looks like the ring is formed by bone, but normally the ring is actually a concave surface of bone and then a complete ring formed by a ligament. There are a few excellent examples of pivot joints within the human body. The median atlantoaxial joint is an articulation between the dens of C2 and the C1 vertebra, with the anterior arch of C1 articulating with the dens and a complete ligamentous ring being formed by the transverse band of the cruciate ligament. This allows the C1 or atlas to rotate axially around the dens, which remains in a fixed position. It is this joint that allows the head to rotate to the left and to the right. The proximal and distal radioulnar joints are also examples of pivot joints, and when they move in combination, they allow pronation and supination, a very specialized movement of the forearm. We can see here the radial head sitting within a shallow concavity on the ulna with a complete ligamentous ring, the annular ligament, holding the head in position and allowing it to axially rotate. The final type of joint is the plane joint. This is another joint that only allows 1 degree of freedom of movement, and that is a gliding or sliding movement in the same plane as the articular surface. Examples include the intercarpal joints within the wrist and intertarsal joints in the foot, the facet joints in the spine, and the AC joint. Here's an example with the facet joint, 2 surfaces which are completely parallel to each other and allow simply a gliding movement in that plane. The main thing to take away from this presentation is that there are 3 structural types of joints: fibrous joints, cartilaginous joints, and synovial joints. Examples of fibrous joints are the cranial sutures, the syndesmoses between the radius and ulna and tibia and fibula, and the gomphosis joint of the teeth. Cartilaginous joints can be divided into primary and secondary, with primary being synchondroses and secondary cartilaginous joints being formed by fibrocartilage and being symphyses. Synovial joints come in multiple different forms, allowing varying degrees of freedom of movement. And if you've got to the end of this talk and you don't understand the difference between synchondrosis, symphysis, syndesmosis, and synarthrosis, you're feeling a little bit confused, then you should go back and watch this tutorial again. Just a reminder about our medical imaging anatomy course coming up in Melbourne on April 9 and being released on video on demand on May 1. Visit radiopaedia.org/courses to register.